So hello to our dear Dr. Melvin Marshall, our clinical clerk supervisor, to our advisor in Green Team, Dr. Julian Artapispisan, to our dear consultants, and to everyone that who will be viewing my final reflection in my first loop in internal medicine. Hello po sa inyo. So please bear with me. I use Zoom to record this video because I am not that techy, and also so that I will be able to use a virtual background of our beloved alma mater, the Pontifical, Royal, and Catholic University of the Philippines, the University of Santo Tomas. And I do believe that we really miss UST right now. In my 8 years stay in UST, 4 years in college, and 4 years in medicine, I really miss UST. And I hope and we all pray that we can go back to our second home. And also in my virtual background, before I read to you my prepared final reflection in internal medicine, I prepared it, I composed it so that wala po akong makakalimutan na banggitin at pasalamatan. So also in my virtual background, I would like to discuss briefly my personal logo, the logo that I used in my e-portfolio. So just a brief discussion. So as you can see in the right-hand corner, this one, it's like a sun with different symbols inside the sun. So the sun is very similar with the sun in the Philippine flag, the 8-rayed sun. So I took the inspiration. It symbolizes my being a Filipino. Even if we are in dark ages, even if our country is facing so many tribulations and so many challenges, I am still proud that I am a Filipino. I am still proud that I belong to this glorious race. That's why that sun symbolizes the greatness of a Filipino. Okay? In the center is the ultramar or the sea lion. It was bestowed by the Kingdom of Spain to the city of Manila when we are still under the Kingdom of Spain. We are still a colony of the Spain 500 years ago. So it symbolizes being a Filipino, our heritage again. And kung inyo po makikita, yung ultramar na yan, makikita nyo sa sagisag ng Pangulo ng Pilipinas, sa sagisag ng lungsod ng Maynila, sa sagisag ng pangalawang Pangulo ng Pilipinas. So it symbolizes again my being a Filipino. And I would like to emphasize a little bit yung hinahawakan po ng ultramar. In the left hand of the sea lion or the ultramar, as you can see in a striking pose, yung nakaganto, is the rod of the Greek god Asclepius. I took that as my inspiration from the logo of the University of Santo Tomas Faculty of Medicine and Surgery. The rod of Asclepius symbolizes healing and medicine. So hopefully I will become a physician. By next year, I will graduate, hopefully, in 2021. So aside from being a Filipino, I'm also a future physician. That's why the ultramar is holding in a striking position the rod of Asclepius to guide my life, to guide me in the path that I will be taking. And in the right hand of the ultramar is the lamp of Florence Nightingale. Because I took that lamp of Florence Nightingale because before I become a physician, I am first a nurse. Yes po, nursing was my pre-med course in UST. So the lamp of Florence Nightingale is lighting the path that I am treading. So kumbaga po, nasa right hand, hawak-hawak ng ultramar, that's my symbol. you lamp the Florence Nightingale to guide my path, and yung rod of Asclepius to direct my path. So that's why nursing and medicine, they have important place in my heart. To light my path, the lamp of Florence Nightingale, and to guide my path and to direct my path, the rod of Asclepius, so that I can become the best nurse and a future physician in my future patients. So that's it. So that's the brief explanation of my personal logo. So let's now go to my final reflection in internal medicine. When I was in kindergarten, I am always amazed by how my pediatrician can cure my disease. Sabi ko nga po, si doktora, may ilagay lang ang stethoscope sa akin, gagaling na ako. That's the naive thinking that I have. Pag ako pupunta sa clinic ng doktor ko, nung bata pa ako sa pedia, pag nilagay lang dito ni Doktora 9 yung stethoscope niya, feel ko and gets ko gagaling na ako. That's the wonder that my naive mind has. I believe in her and admired her that someday I want to be like her. To be a physician with a heart. Nasa puso at nasa murang pag-iisip ko po nung bata pa ako na gusto ko na maging doktor. At a young age, Kinder 1, Kinder 2, pag nagkakasakit ako, ubos sipon. Nasa isipan ko yan, gusto ko maging doktor. Dahil na-inspire ako nung doktora na yon to take up medicine, to heal my patients. It might sound cliche, but my inspiration to become a doctor is to be of service to my family and my fellow men. Fast forward to my elementary and high school days. Hindi pa din nagbago ang pangarap ko. Gusto ko pa rin maging doktor. Without any idea, ilang taon ba bago maging isang doktor? Kailangan ba mag-pre-med? Ano bang kailangan ko para maging doktor? Walang idea po. I just want to become a doctor. Period. Kahit anong mangyari, gusto ko po maging doktor. And to be honest, I never planned my pre-med course. And also, I only applied in UST for college. Kasi yun lang po ang kilala kong school. Aside from UP, kung saan doon graduate ang papa ko. UST was, is, and will always be my first choice. Siguro malaking factor na din kung bakit UST lang yung kilala ko, because I was confined in UST way back first year high school sa dating Santo Niño Ward. Yung bagong St. John Paul building, before it was erected, may annex pa dyan na hospital. Santo Niño Ward po ako na-confine doon dati. First year, high school. And I saw how the nurses and my doctors interact with me. And my pediatrician during the time was Dr. Iluminada Lerma. And I still remember her. UST made a permanent mark in my heart. And this is always my dream school. So after 4 years in college, I love my profession. So nag-umpisa po ako na hindi ko alam ang pre-med ko, pero minahal ko ang pagiging nurse ko. And I was caught unaware that I am already close in achieving my dream. Fourth year college na ako. Nagulat na lang ako pag-isip ko sa umaga, ay, abot kamay ko na pala yung pangarap ko bilang isang doktor. Parang ang bilis ng panahon. It seems it was only yesterday that I was in preparatory na gusto kong maging doktor. Tapos ngayon, kailangan ko ng mag-submit na requirements for my chosen medical school. In fourth year college, nagulat na lang ako that I need to take my NMAT and apply for med school. And the same happened. I never applied to other medical schools. Sa UST lang po ako nag-apply. Siguro po, sabihin nyo, wala akong backup plan. That's only my plan. To study in UST in college and to study in UST for medicine. UST will always be my one great love in nursing and medicine. So that was my journey before I entered med school. Hopefully, I will be the first physician in our family. We are a family of teachers po. My grandparents in both sides are teachers. My titas are teachers. My cousin is a teacher. So kumbaga po, ako lang yung lumihis sa landas. Bakit ka hindi nagturo? Bakit ka hindi nag-education? Kaya nga sinasabi nila, ako lang daw po yung naligaw ng propesyon. Sorry, excuse me po. So this is very raw video, okay? Sabi ko nga po in my disclaimer a while ago, I don't know how to edit videos. With this journey, my love to become a physician and an internist grew even more. It is my dream not only to become a physician with a mind, but also a physician with a beating heart that is sensitive to the needs of my patients. There is really a long and challenging road in order for me to reach my dream. Hindi po naging madali ang maging clinical clerk. Hindi naging madali ang pumasok sa UST, even in college and even in medicine. But this dream to become a physician with a heart and a mind that is beating and thinking for the welfare of my patients became my inspiration. It is true that success is never an accident. It is hard work, perseverance, learning, studying, sacrifice, and most of all, love of what you are doing or learning to do. There are many prerequisites to success, but what struck me the most is the last. For me, the most important thing that someone must have in order for him to succeed, and that is his love for what he is doing or learning to do. Love is the greatest motivation in life. It is something that keeps us going. Again, it might sound cliche, pero that's what I felt. And to be honest, that's what I'm still feeling right now. Kung mahal mo ang ginagawa mo, kahit gaano kahirap, it will always be worth it. It seems it was only yesterday when I attended our IM orientation with our very helpful, intelligent, and talented clinical clerk supervisor, Dr. Melvin Marshall. I do admit that I am overwhelmed with all the activities that we will be having. Orientation pa lang po, nang hihina na ako. Kasi before our orientation with Dr. Marshall, we had orientation with our color leaders. So parang pagod na ako. Ang daming ginagawa. Ikaw ba naman ang unang mag-ER conference, tapos bigatin pa ang mga facilitators mo? Hindi ka ba naman kakabahan? But with our teamwork and with the help of our dear consultants, most especially Dr. Marshall, with all the repositories he made available for us, naitawid po namin lahat, hindi lang ang ER conference, pati na rin ang therapeutic conference, admission conference, and epitome. All the activities in IM made me nervous, but it also pushed me to give my best, to read more, to ask more, most especially if I don't know anything or if my knowledge is lacking, and to know more. It is never enough that I know something. Rather, I should know it and be able to apply it in real-life situation. Yung sinabi ni Dr. Marshall, yung CPG, nandiyan yan to guide us. Pero we need to tailor fit our management pa rin to our patient. That strike me the most. Oo nga, may hard copy dyan eh. Guide lang yan. But based on your clinical judgment, kung hindi kaya ng patient or kung mas mabuti yung workup na yun sa patient, by no means, do it. It is never enough, and it will never be enough. That's the hunger for knowledge that I have. All the conferences and activities are really useful in trying to simulate real clinical scenario and allowed us to think more and differently. Wala pong dull moment and walang nasasayang na oras sa IM. Paminsan nga po, kulang pa. Kulang pa ang oras sa internal medicine. Maya-maya, sa ginagawa mong mga conferences, sa pag-update ng e-portfolio, I'm so engrossed in doing those things. Maya-maya, uy, umaga na pala. Hindi ako nagrereklamo because it's part of the learning. It's part of the process that I need to undergo for me to become a physician. It is true that internal medicine is the most challenging rotation. I lack sleep in order to finish my reports, my e-portfolio, my case discussions, my patient's chart in cardiology, and in reading the dreaded ECG tracings. Nung una po, hindi ko talaga maintindihan kung paano ba magbasa ng ECG. Aside from that, I also need to prepare for my different synchronous activities and accomplish my asynchronous activities. I am literally tired and exhausted for the past month. But I go back again to the question, what keeps me going for the past month? My answer is simple. It is my love for my future profession that keeps me going. My passion to become a better physician someday keeps me going. And the love that our dear consultants and our dear professors showed us inspired me to keep me going. Mahirap, given na yun mahirap, pero balik tayo sa unang question. What keeps me going? Sa commercial nga po ng isang kape, para kanino ka bungabangon sa bawat araw? What keeps me going? Very simple. It is my love for my future profession. It is my passion to become a better physician. And it is the love and dedication of our consultants and professors that inspired me to keep me going. There is no easy way to success. You need to sacrifice a lot of things, but I know it is definitely worth it. My internal medicine first loop rotation might be the most challenging rotation, but I learned so many things in that rotation. I learned to become a team player as we do our different conferences. Our ER conference, na madaling araw na kami natulog para lang ma-prepare ang presentation. Our Theracon, para malaman kung ano ba ibibigay sa patient namin sa ER-con. Our AdCon with Dr. Ko to prepare our questions for our virtual patient. And our epitome to think what are the things that we need to do to our patient in the OPD setting and other conferences and case discussions, most especially the patient as teachers interaction. I really love that one. Gustong-gusto ko po yung meron kaming teleconferencing with our patients. Feel ko na ako po isang doktor na during those activities. I feel that I truly belong to a family in my 1-month rotation in medicine. Totoo po yun. Yung ginawa ni Dr. Marshall na meron kaming COVID-19, tapos meron kaming caller group, we have our leader, we have our advisor. For 1 month, I feel that I belong to a family. Hindi ako nawala, hindi ako na-lose astray because I feel that I am in a family. To be honest, I am really sad that this rotation comes to an end. Meron po separation anxiety. Also, I learned to read more and watch all the available learning materials in our repository that widened my knowledge in internal medicine. Also, I learned to budget my time properly by studying for the conferences, case discussions, and other synchronous activities that I will be having the next day. The rigorous activities that I had made me a better clinical clerk. I started my clinical rotation July 1. Pero ngayong August ko lang po na-feel na clinical clerk na ako. The activities that allowed me to think, the activities that challenged me to give my full potential made me feel that I am already a clinical clerk. I do appreciate all the things that I engage with because it challenged me to always give my best and strive to learn and achieve more. Lastly, a doctor's mission is not just to prevent death, but also to provide and improve the quality of life of his patients. I always find strength in these words of Dr. Patch Adams. You treat a disease, you win, you lose. You treat a person, I guarantee you will always win no matter what the outcome. Every time I lose focus and hardly hit rock bottom in my journey in medical school, his words comfort me and allow me to get up and continue my long and endless journey to become the best physician that my future patients deserve. With this internal medicine rotation, it made me love even more internal medicine. Sabi nga po ng iba, pag nawawalan ka na ng focus, go back sa start. Go back to the core. Bakit ka ba nandyan? And it helped me in IM. Bakit pa ako nandito sa internal medicine? Para sa pamilya ko, para sa mga pasyente ko. Mahal ko yung ginagawa ko. And hopefully, if given the chance, I want to become a different physician. A physician with a heart. Physician pumasino. Physician na may puso para sa pasyente niya. Na hindi lang yung disease ang ginagamot, kundi yung totality ng kanyang pasyente. And I do believe we need those kind of physicians. We need them more. And hopefully, I can become that someday. With this rotation, it challenged me to become a great internist someday. IM will always be my one true and great love. To our dear professors, and most especially to you, Dr. Melvin Marshall, our clinical clerk supervisor, and to you, Dr. Julie Ann Artapis-Pisan, our dear Green Team advisor. Maraming salamat po. Thank you for the love and for the concern that you showed us. Thank you for teaching me and inspiring me to become a better version of myself each day. To sum up this internal medicine, mahirap pero masaya. Worth it? Definitely worth it. Babalikan ko ba ang internal medicine? Of course. And hindi po to pambobola. Aside from being a physician, it's also been my dream to become an attorney someday. Hindi po ito pambobola, gaya na sinabi ko. Aside from being a physician, not just a physician, I want to become an internist someday. Hopefully, I will take up internal medicine in my residency and become a gastroenterologist, a cardiologist, or any specialization. Magbabago pa po yan. But one thing is sure. I will become an internist someday. This internal medicine rotation made me love internal medicine more. Maski mahirap, maski nahihirapan, at maski mahihirapan pa, maski toxic na sinasabi nila, worth it po ang IM. I will surely miss internal medicine, all the professors, all the activities, and hopefully po, may second loop na. See you again in the second loop, and thank you so much for this first loop. Maraming salamat po sa inyo lahat. Once again, I apologize. This is a raw video. I don't know how to edit. That's why very spontaneous po yung aking final reflection. Thank you, and God bless us all.